Morning after pill is just a very, very, very high dose of a hormone. So the idea is that what you do is kind of shock your system. So the system itself, for reproductive purposes and for conception, needs very careful balance of your hormones and throughout your cycle. By shocking the system, you change that hormonal balance and you make the system unfavourable to conceive. Simple as that.
The morning after pill has been available on prescription. What prompted the decision to make it available over the counter?
This is part of an overall reform of healthcare, and one of the real keys here is to allow patient choice. There's very much a move towards allowing patients to be more engaged with their clinicians, more engaged with their own decisions about healthcare. While we are, of course, following the model that's established in the UK and Europe, we're also very keen to allow patients to make their own choices about their own healthcare, their own decisions. And this is a perfect example of how you can choose to come and see a doctor to talk about this, or you can make that decision and you buy it over the counter yourself.
Under what conditions might a woman take the morning after pill? Are there age considerations or are there medicines that need to be factored in?
So the key behind this is that the pharmacists are really very much a community source of medical advice and medical support, and perhaps very much underestimated. From a point of view of actually providing this over the counter, we put in lots of safeguards. Clearly the key is that the woman concerned makes that decision first. It is the right decision for her at that moment, and the first thing, of course, is timing. Some of these pills, well, both of them actually that are on the market, have quite tight restrictions on timing, and the sooner you take it, the more effective it essentially is. But when you go to the pharmacist will want to run with you through a series of questions just to check things like, of course, age, very important. Medical conditions that are ongoing, such as, for example, heart disease or blood pressure, for example, other medications that might reduce your absorption of the pill, or perhaps medications that affect your liver that might reduce the effectiveness.
So the decision was clinically driven. How do you reconcile that with the fact that 3 doctors at the primary care centre opt out of prescribing contraception and also the morning after pill?
Well, it's very important just to say that they're not opting out. They're essentially exercising their belief that they don't agree with it, but they have taken on additional responsibility as a result to find another clinician who will support them. And while, of course, there is a clinical imperative where this is concerned, and clearly time is important, we have to bear in mind that doctors are people also, and they have their own beliefs, their own moral understandings. While we have to be very careful on this, is perhaps a sort of ethical issue here. While that doctor is able to exercise that belief cannot interfere or disrupt good clinical care. And what's the irony of this is perhaps you can think that could affect a patient's care, but interestingly enough, those 3 doctors and any doctor that would exercise that right, just as any patient would exercise their right to have their own beliefs, that doctor has actually taken on an additional responsibility. Because if you come and see a doctor who essentially says, I can't give you this medication, it's their responsibility to find you another clinician there and then, particularly in the case of the morning after pill, because timing is so important. So they then have to go and find a colleague who they have a good rapport with and explain the situation and ask their colleague to help there and then. So it's not a decision taken lightly by any clinician by any means.
And the same applies to contraception. Would these doctors object perhaps to prescribing contraception? Would they have to do the same in that scenario?
In exactly the same scenario. Clearly the timing is not so important because with the morning after pill, for example, every hour counts. But with contraception itself, yes, if they have a moral objection to it or maybe on religious beliefs, the same would apply. They have to provide an alternative clinician to discuss that with the patient, because this is clinically driven. But interestingly enough, the General Medical Council, who is our governing body, will allow for doctors to exercise this right of belief if they so wish, but places greater responsibility on that doctor. So as I said earlier, it's nothing to be taken lightly.
What kind of morning after pill will be available?
We have two commercial products over the counter available at the moment. Levenel One Step, which many people will be familiar with the word Levenel. It's gone through various kind of guises in the past: Levenel 1500, and now Levenel One Step. That is the slightly cheaper product, and that is effective for up to 3 days, 72 hours. And then we have a product called Ella One. And Ella One is effective up to 5 days, so it actually is a slightly stronger dose of the hormone to give your system a bit of a greater shake-up, and is, as a result, slightly more expensive.
What are the side effects that might come with either of those pills?
The research over a number of European countries over years and years and years has shown that nobody has ever come to harm taking the morning after pill, not a single patient. So in itself, in terms of long term, it is very safe, but it has short term side effects. The critical one is actually vomiting and nausea, because it is giving you such a high dose of a hormone. The problem with that, of course, is that the crucial thing is to keep it down. And so actually a lot of the discussion around the morning after pill from a GP or from a nurse practitioner or the pharmacist will be based around advising you of that. Now, while every hour counts, sometimes in the past I've certainly counselled women to take it perhaps at bedtime, to allow that nausea to not really impact while they're sleeping, to ensure you can keep it down. Now, having said that, if you are unfortunate enough to actually feel so sick that you vomit the pill within the first few hours of taking it, and therefore it's not in your system and it's not working, you are able to go back to your pharmacist and explain that to them, and they will not deny you another one. They will be able to sell you another one.
What happens in respect of girls or young women who might be under the age of 16?
Yes, this is a very, very important question, and I suspect one on many people's minds. We follow very closely the UK legally established precedent on this, which are known as the Fraser Guidelines. They used to be called the Gillett Guidelines, now Fraser Guidelines. Essentially what they're saying is, for any patient under 16, clearly in the case of morning after pill for girls under 16, the assessment that the pharmacist is required to make, and they are trained to make, is whether that particular patient is able to understand what they are requesting and take responsibility for it. Now, I appreciate that that's quite a difficult assessment, but as I say, all the clinicians and the pharmacists are trained to do this. However, the very, very, very clear instruction to the pharmacist is that if they feel in any way uneasy about this, or they feel that the patient concerned does not fulfill these Fraser Guidelines, then they are advised to inform the patient to come straight to us or to A&E if necessary, because timing is an issue. But the primary care centre is the main place that we can advise on this, to discuss with a doctor that day in an emergency clinic if necessary, preferably routine, but emergency clinic if necessary.
When GBC called around the pharmacies yesterday, they didn't appear to be expecting this change on Thursday. Will they be ready?
They will be ready. The reason for the delay, the pharmacists were informed informally. And the reason for the delay in giving them formal notification is I needed very much to clarify this issue about the Fraser Guidelines and for underage, for patients who are under the age of 16. It's such an important point that clinically I felt it was important that we clarify that point first. The official notification letters have been received by all the pharmacists this morning, and they are fully prepared for the 3rd of August.